Nou, so gepraat van 'n vrouemaand, is dit ook belangrik om oor die volgende onderwerp te praat. En Dr. Deel, hoof van die Intervensionele Radiologie by Groote Schuur-hospitaal, sluit vanoggend by ons aan. Good morning, doctor.
Good morning, Jennifer. Good morning, Francois. Good morning to all the viewers. Thank you for having me.
It's our absolute pleasure. It's so important to speak about this. And let's start with obviously the basics. What exactly is interventional radiology?
Now, that's a great question. So I think we should start off with what is radiology. So radiology is the ability for a doctor. We specialize in the understanding and diagnosing of illnesses with imaging. So whether that be CT scans, ultrasounds, MRI scans, any types of imaging modalities that you see when you go to a radiology practice. Now, where interventional radiology steps in is actually use all these different modalities or types of imaging to perform minimally invasive procedures inside the body, which means you don't need to have surgery. So that's basically what interventional radiology is.
Okay, Dr. Deel, but how does that play a role in women's health?
Yeah, so it's a recent, I wouldn't say recent, for the past 20 years, there's been a lot of research into a particular condition, which is uterine fibroids, which are benign or non-cancerous growths of the womb, which a lot of women suffer with. And the traditional way of managing it was a surgical way, which is you either remove the fibroids one by one in a procedure or in a surgery called myomectomy. And then unfortunately, in some cases, a lot of women with these non-cancerous growths, they're so big that they end up having to remove the entire womb.
Yeah.
And now with interventional radiology, we're able to work inside the blood vessels using x-rays, like a video x-ray, and guiding a small tube inside your body to find the blood vessels that supply the fibroids in your groin region or your pelvis. And we inject these very small particles. They look like grains of sand. And they actually just all rush up and pile up against the fibroids and block the blood supply. And what happens is that eventually these fibroids die, and then with time they shrink. And between 3 to 6 months, your fibroids will disappear. So it's you can almost you don't even have to take your clothes off for this procedure. It can be done quite quickly and easily with a bit of x-rays and a bit of expertise. And it's really changing lives. So it's really been quite a huge thing all around the world. And we're great to be able to offer it both in the private and in the government sector at Groote Schuur-hospitaal. So, yeah.
You know, you took the words right out of my mouth, changing lives. I mean, you spoke about removing wombs to just kind of a very non-invasive thing that kind of dies within months, and it's really incredible to see. I think a lot of women think that pelvic pain or heavy, periods is just part of life. It's just a common thing. At what point do women need to actually seek some help?
Yeah, so I think it's definitely, you have to pick up that there's been a change in your periods. So for example, it's become heavier, there's more pain, the periods are irregular, maybe they're happening like it doesn't go away usually as in the normal cycle that it does. But the main symptoms are heavy menstrual bleeding that almost affects your quality of life, to the point that you could say there's a lot of women that I consult that end up with anemia as a result of having bleeding, that excessive amount of bleeding, and having to take iron supplementation in order just to remain. I mean, when you're anemic, you're so tired and drained, and you can't really function well. So I think that if you have the signs where you have a really excessive period and you're also feeling a bit tired, and maybe sometimes fibroids can be so big that you almost look like you're 30 weeks pregnant. I've had patients that are about 30, they feel like they're 30 weeks pregnant. They've got like a little it's as if you're pregnant. So
wow.
And they come back to me in about 6 months' time and tell me that now they're bikini ready.
Oh, that's good news. Especially in Cape Town, next to the beautiful sea you have. Dr. Dale, there's a procedure or a process called uterine fibroid embolization, or UFE. What is that, and how can that help to give for women results they can expect?
Yeah, so Francois, I think maybe I just spun it too quickly, because I was basically talking about uterine fibroid embolization, where we actually embolize the fibroids.
Okay.
So yeah, it's all fancy jargon for the same thing that I just said to you. It's just basically using the tubes with these small particles and blocking the blood supply to the fibroids, which eventually makes them shrink. And we use X-rays to do that. So that's uterine fibroid embolization in a nutshell.
But it's good that you said it twice, because we, as the gewone mense here on the street, won't realize what it means. I'm thankful.
We often hear the term minimally invasive, but I mean, we don't actually know what that means. And earlier you kind of slid in the fact that you can even wear your clothes. Is it in practice really that minimally invasive?
Yes. So I think the only really true minimally invasive medicine comes from interventional radiology. There's lots of different surgeons that might disagree with me, but at the end of the day, why I say this is that it's equivalent to putting in a drip.
Okay.
It's basically it. If you think about putting in a drip, it's equivalent to putting in a drip, but all we do, that same access that if you imagine when you have a drip, there's a catheter that's in a blood vessel. This time we don't put it in a vein, we put it in an artery. And we actually, once you've got that access, you're able to do everything through that one access. So if you can imagine maybe, I mean, I've had some bad drips in my life where I've had a little bit of scarring, but it's a little blob in my skin, right? And that's basically it. It's not an operation. You're not having scarring. You don't have these wounds. You don't have the chances of the wound getting septic. There's lots of things that. So when it comes to truly minimally invasive medicine, that is interventional radiology.
Well, that's just awesome to hear, and making the lives of so many people, women, but I assume men as well, that you can use it for. Maybe in Men's Health Month, we can talk about how we can use interventional radiology in men's health. But besides fibroids, how can you use interventional radiology to help and treat women?
Yeah, so there's a few conditions that we manage, and we manage it with the gynecologists. So we work closely with gynecology to help patients with tubal obstruction. So if you imagine, sometimes women struggle to fall pregnant, and the fallopian tubes, or the tubes that carry the eggs into the womb, are blocked. And sometimes they go for tests to find out why they're not getting pregnant, and one of these tests is called another fancy long jargon word, hysterosalpingogram, right, or otherwise called an HSG. It's basically just an X-ray where they do an X-ray and they inject the dye into the womb to see the dye go through the tubes. And if they don't see it go through the tubes are blocked. So we are able to actually use catheters to open the tubes as they go towards the eggs. So it helps the eggs come back into the womb, and you'll be able to fall pregnant as a result. So that we can do that, and then without an operation. Unfortunately, you'd have to take your clothes off for that one. So the other types of procedures we have that assist women. So it's a quite a rare condition, but something that a lot of women don't really get answers about, and it's really complicated to explain. But the way I explain it is this: it's called pelvic congestion syndrome, and what it presents is a woman who has a really dull, aching pain in her pelvis that she can't explain. It's just always there, and what happens is that you can almost imagine, if you think about varicose veins in your legs, right? So some people get varicose veins, and those veins are not working too well, because veins have little valves, and what they do is the valves push the blood back up to the heart, So there's different, when you move your body, it pushes the blood back up. But sometimes when the veins become a bit incompetent, or they don't work too well anymore, the veins then pull with blood, and then they just sit. So imagine now in this unfortunate lady's pelvis. She's got a whole sack of varicose veins in her pelvis. And they don't know, most people don't even know what to do about it. They go for 10,000 investigations. It's actually called a diagnosis of exclusion because they find it only when they do a CT scan and they're like, oh goodness, there's these veins in the pelvis that nobody knows what to do about. We are able to fix that. So it's unfortunate that it takes that long for us to get to this point. I think not a lot of doctors know that interventional radiology exists in South Africa. It's quite a new subspecialty, and I had to train in Canada to come back here and work. So we're learning and we're teaching doctors that if patients have these problems that they need to refer it to us, we can actually redivert the flow and stop those veins from pooling with blood, which can help patients live a better life. Yeah.
Dr. Dale, it has been so informative and also goes to show we don't know what we don't know, and it's been very educational to hear how you can really help change women's lives. Thank you so much for your time this morning.
No, thank you for having me.
Sjoe, daar het jy dit. Die antwoorde wat jy dalk net nodig gehad het, Dr. Dale Creamer, jy weet hy is by Groote Schuur-hospitaal vir ons alle antwoorde kom gee vanoggend. Bly net nog wees. Ons is nou weer terug en dan gesels ons met 'n kunstenaar.